A very good afternoon to all. Today we are going to look about balanced occlusion. A lot of doubts have been arised regarding this balanced occlusion, and I guarantee that once you watch this video, you will be able to solve most of the MCQs related to this balanced occlusion. Okay, I'm going to tell you in a very simple way what is balanced occlusion. Okay, see, if you take a seesaw, okay. So there should be equal weight so that this is balanced. So for example, if I am telling a 20 kg boy to sit here, and if I am letting a 30 kg boy to sit here, then obviously it is going to come down. So that should not happen. So what I am going to do, I am going to either increase this to 30, I am going to change this person to 30 kgs, or I am going to decrease this to 20 kgs. I can do either of them. By that I am balancing my seesaw. Okay, this is very similar to the balanced occlusion. Okay, before moving into what is called as balanced occlusion, you should know what is Christensen's phenomenon. What is Christensen's phenomenon? Christensen's phenomenon is very simple. In a natural dentition, in a dentulous patient, whenever I bring the mandible forward on protrusion, whenever I protrude the teeth, only my incisal edges are in contact, right? So the posteriors are out of contact, and whenever I do a lateral side to side movement, only my canine is in contact. Okay, this is Christensen's phenomenon, and this Christensen's phenomenon cannot be applied in a edentulous patient. I'll tell you why. So if you look at a edentulous patient, they are wearing a complete denture, maxillary and mandibular complete dentures. Okay, so what happens whenever I trying to protrude the mandible in a patient who is not having any teeth, I am putting some complete dentures, and I am telling the patient to bring the mandible protrusion. I am telling the patient to protrude. If there is a Christensen's phenomenon, only my incisors should be in contact on protrusion. Ultimately, my posteriors have no contact, and that is going to rotate or lip or fall off, because there is no stable relationship between the complete denture and your jaws as in your natural teeth, right? So similarly, if I tell the patient to move laterally, and if the denture is having Christensen's phenomenon, then the side which is not in contact is ultimately going to fall off or rotate and lip. So that should not happen. So what is balanced occlusion is, I want contact of the teeth in all the centric as well as eccentric movements. Fine. So my teeth should be in contact in centric as well as in eccentric. What are the eccentric? Eccentric is your protrusive and your lateral movements. So whenever I do a complete denture patient, to attain a balanced occlusion, I should make sure that the contact should be made in all the directions: centric, eccentric, protrusive and lateral. So the Christensen's phenomenon should not be applied. Okay. Now, for this to achieve the balanced occlusion, there are several factors which used to maintain it. So I'll write it. One side of the factor, if you see, it is the incisal guidance, the condylar guidance. Okay, the incisal guidance, the condylar guidance. The other side of the line is going to be the plane of occlusion and the cuspal angulation and the compensating curves. Fine. These is the factors which is going to govern the balanced occlusion. Okay, I am going to write a simple formula for this. Incisal guidance into condylar guidance, it should be equal to the plane of occlusion into the cuspal angulation into the compensating curves. I'll tell you how. So this formula is known as the Thielmann's formula. Very important formula, right? So whenever I am trying to increase this also should be increased, right? That is a rule. So I'll tell you what is a condylar guidance. In simple terms, condylar guidance is nothing but you have the condylar fossa, you have your condyle articulating inside it, isn't it? So the movement of this condyle inside this condylar fossa, we call it as condylar guidance. It is the only factor factor which cannot be controlled by the dentist. You cannot control this condyle guidance. It's as simple as that. Okay, so now it is evident that in this category I can change only my incisal guidance. The condyle guidance cannot be changed. Okay, now what is incisal guidance? So incisal guidance, if you see, okay, let's take a teeth, the anteriors. Okay, so let's assume that this is my maxillary anteriors and this is my mandibular anteriors. So this is the occlusal plane. Okay, so the incisal edges, right? So I am drawing a line through the incisal edges. Okay, so this is my incisal guidance. So the angle formed between the occlusal plane and the line joining the tip of your incisal edges, this is the incisal guidance. Okay, now this incisal guidance I am going to classify into two ways: overjet and overbite. Okay, overjet, as we all know, it is your horizontal overlap 2 to 3 mm, and overbite is a vertical overlap, it's going to be 0.5 to 1 mm. I can change it? Yes, definitely I can. So I'll tell you a simple scenario. If I'm trying to bring the teeth, okay, this is the normal thing. Okay, if I'm trying to bring the teeth down, okay, which means assume that the teeth I brought it till here, this is my incisal edge and this is my incisal edge, so this is my occlusal plane, and I'm drawing a line like this, isn't it? So my angle of incisal guidance is increased. So whenever I increase the overbite, my incisal guidance angle is going to be increased. Okay, another scenario, and I am just increasing the overjet, the horizontal overlap. So now the plane of occlusal line and the incisal edges, they are more or less the same, so the angle is going to be decreased. You find the relationship of the overjet and overbite to the incisal guidance? Yes. Okay, now what is this plane of occlusion? Plane of occlusion is very simple. Plane of occlusion is defined as the line joining the ala of the nose to the superior border of the tragus, not any point on the tragus, it's just a superior border on the tragus, right? So for example, it's going to be somewhere like this. See, this is ala of the nose and this is your tragus, it's going to be somewhere like this. So I cannot make it steep like this. So what is the limit? So the plane of occlusion can be adjusted only up to 10 degrees. Okay, cuspal angulation. So if you look at the teeth, okay, this is your horizontal line, and this, assume that this is your mesiobuccal cusp, and the angle formed by this slope and the horizontal plane, this is your cuspal angulation. So whenever I want to reduce the cuspal angulation, I should not reduce my cusp tip, rather I should reduce the cuspal slopes, because that is what the cuspal angulation is all about. So the angle formed by the horizontal axis and your slope, your mesiobuccal inclines, right? Okay, for an anatomical teeth, it is going to be around 33 degrees. For a semi-anatomic teeth, it's going to be 20 degrees. For a non-anatomic teeth, it's going to be 0 degrees. Okay, so what is this compensating curve? Compensating curve, if you see, compensating curves can be of three types: curve of Spee, curve of Wilson, curve of Monsoon. Okay, so this curve of Spee is nothing but starting from the mandibular distal aspect of the canine all the way to the condyle. So it will be somewhat like this, right? So this is an anteroposterior curve, and curve of Wilson is your mediolateral curve, right? So your if you look at the mandible, your molars are lingually inclined, so that the buccal cusps are more taller than your lingual cusp, so that it can, as a functional curve, it's your opposing functional cusp, right? So that is all about. So Wilson's curve is your mediolateral curve, and curve of Spee is your anteroposterior curve, and curve of Monsoon is a combination of these two. Okay, so if you look at the balanced occlusion, these are all the 5 factors which are going to govern it. So the question has to be very simple. Most of the question will be, when I have a steep condylar guidance. What is steep? Increased. It's very simple. Increased condylar guidance, my compensating curve should be how? It should be definitely increased, isn't it? Okay. When I have an increased condylar guidance, how should my overjet and overbite be? Okay, now I'm not coming into this aspect. So the question is here, whenever the condylar guidance is increased, what happens to my overbite? Right. So coming to this concept here. So increase in the overbite. Right. So it is going to increase my incisional guide angulation. So whenever I am going to increase my condylar guidance, to compensate it, I have to decrease it, isn't it? So you have this formula in your mind. So you can, one way to remember this formula is going to be as we all are preparing for the PG entrance examination, you can remember it in this way. So somebody you need to guide you, right? So guidance, you keep guidance at one side, and the other side you should have three things. You should plan properly. Planning is very important, and you should have a crisp notes, and you should compensate whenever you, for example, if you have a doubt in certain subjects or your subject seems volatile, you should compensate that by reading whenever you get a free time, right? So this should be the three ultimate goals. So you keep the guidance, so incisional guidance, condylar guidance on one side, and the plane of occlusion, crisp notes, so CP, cuspal angulation, and compensating curves. So this is one way you can remember balanced occlusion. So this is all about balanced occlusion. So keep this in mind and solve the MCQs. It will be a little bit easy for you, and in case if you have any doubt, you can post in the comment section. Thank you for watching this video, guys.